game-changing discussions on the big ideas that shape our thinking. This is One-to-One. Previously on One-to-One.
But having had a front seat through that period and seen a small team that most Nigerians had never heard about stand up, respond, do their best, lead through adversity, support our leadership, support the people, gain the trust and confidence of Nigerians, I felt this was a part of our history that I had a responsibility to write.
I'm not going to read directly from it. I'm going to read a paraphrase in advance that I've scripted. For me, one of the most powerful themes that emerged quietly across the pages of this book, like COVID-19 really did not create Nigeria's weaknesses. It revealed them. And in doing so, revealed the few institutions that you've already mentioned that have been quietly built to withstand pressure. I'd like to go back and take another bite the cherry there and try and understand how you as an individual were feeling as you went through that period of what I would call institutionalization under constraint.
So this period, the period prior to the beginning of the pandemic, right? I knew I couldn't be an aloof leader with a grand vision that wasn't ready to get his hands dirty. So what we did was to push every aspect of our institution to believe in itself, to look for ways to improve, to thrive for improvement. I was lucky, like I said earlier, we were young parastatals, so I had an opportunity to recruit early and really pulled in lots of young people, 2, 3, 4 years out of unit to come in with that energy. And they did, we built an IT infrastructure, we built systems, but most importantly was they knew I wouldn't drop the ball. Yes. I was the first person in the office, the last person to leave every single day, every single day. Weekends, if my team was working in the lab on weekends, I would go to the lab. I would sit down with them. My wife would cook packs of food. We would take them. I was vested in the institution and its future and its progress and its people. Magic happens. Colleagues who had never published a paper ever in their lives, they didn't know what publishing meant for successful careers. And, it's just an example. We worked with them. We put their work onto manuscripts. These manuscripts started getting accepted. You saw your name as a first author on the paper in the Lancet. And, people start contacting you. This article you wrote on Lassa fever, and published, so they started getting excited about the opportunities for them.
Correct.
There were training opportunities. Colleagues, institutions from the West would say, okay, I've heard about the work you're doing. We want to offer you. There was a specific colleague, he went to do a bioengineering training in Japan, right? So they would offer us one position. I said, no, guys, please, we're a big country. Can you give me 3? So, these young people who had never had an international passport.
Off they went.
And came back transformed because they experienced what I know I experienced growing, that there are possibilities. And so, when you're on a transformation journey, the beginning is hard because you have to convince people on the possibilities, Stokes. But once they start experiencing this and start sharing the stories with their peers, and suddenly they're pushing themselves. It's not me pushing them anymore, But I think that beginning is very tough, and people are watching you very carefully on whether you are ready to walk the work the work that you are asking them to go on. So, incredible experience. There are many, many challenges in the beginning, but happy we had the opportunity to serve when it was needed.
Having established that as a premise, I'd like to ask you, once we've gotten our act together, what an honest conversation, what does an honest negotiation between African leaders and global institutions look like, really, particularly in areas of sovereignty, preparedness, finance?
Well, I think we'll need another session to go to all of that in detail, but I think it will happen on many levels, right? There's the governance level, there's access to financing, access to resources. There's the opportunity to develop our own institution, our own people here. And at the moment, we spend so much time and effort debating politics in our beloved country and sometimes on the continent. And I just don't think we're focusing enough on the basics, right? Infrastructure is important. Big roads are important. But, why should we? Let me give a hypothetical example. Almost everyone with HIV as a disease today is being treated with medicines donated by another country. Almost all the vaccines that our children receive in the public sector, bear a small proportion, is funded with funds that are donated by global health institutions. Why do we as a country feel it is right for us to build our own roads and airports, but we have outsourced the treatment of our children, the vaccination of our children, the treatment of our own patients to some foreign partner? What makes health exceptional that we are not willing to fund it ourselves? This is the fundamental question, because once we have skin in the game, once we're investing in the health of our own people, the conversation will be completely different.
So, Chikwe, I remember reading an article you wrote you published in Nigeria Health Watch, I think it was 2014, 2015. And I think it said Nigeria needs its own Center for Disease Control. And hey presto, a few years later, you were doing the load-bearing work of leading the NCDC as its first Director General. So, but then before 2016, we were responding to epidemics, were we not? But no institution really owned that responsibility. I think it's fair to say. So looking back now, I'd like your opinion on this. What was the real cost of that institutional absence? Not just in terms of outcomes, but in terms of coherence, authority, and speed.
Yeah, it's, Tokes, when I was just appointed, I was appointed in the summer of 2016. Later that year, and early 2017, many people would have forgotten this. There was a big meningitis outbreak in northwestern Nigeria, covering Sokoto, Kebbi, and Zamfara states. The institution barely wasn't existing, but we put some things together. I drove with the team up to Sokoto. We drove around Kebbi, Zamfara. If you've seen a case of meningitis, you will never forget. It's a terrible disease, right? But I saw patients being managed with infusions hanging on trees outside the premises of hospitals and clinics because the wards were full. At the time, there was no national reference lab. There wasn't any lab to actually test and confirm, and to get a sample from a case of meningitis is a pretty tricky thing. You have to take a cerebrospinal fluid. Mm-hmm. So very difficult disease to treat, to manage, to diagnose. We then did an analysis of that particular situation and analyzed the number of deaths that we could have prevented if we had the capacity to act a little bit earlier than we did. We were very open with this. And I say to the team, we are responsible for these number of deaths. We may not be able to prevent every outbreak because you have to find them. But once you know that there's an outbreak, you must be able to prevent its spread and reduce the number of cases. So how does this link back to your question? I think in our country, we had normalized the fact that people die from meningitis, that people die from measles, that people die from cholera. I mean, these are diseases no one else is dying from. Why should Nigerians be dying from cholera? That can be absolutely prevented. You cannot get cholera if you drink clean water. Yeah, it's impossible. So there are diseases that no one else around the world is dying from. That have basically, if you work in the UK, you would never see a case of cholera throughout your career. So the lack of an institution with the knowledge, the expertise to drive this expertise, to drive the country forward in this area has cost us millions of lives. And that's why now we have one. I hope it continues to grow. I hope it continues to find its mandate, find its space, and grow its service to our country. The work we started in 2016 cannot stop. We have to keep growing this institution. The US CDC has over 50,000 people working for it. Nigeria CDC has less than 500 today. So if we want an institution to fulfill its mandate for the Nigerian people, we have to invest in this space and keep investing. If not, we'll keep losing our best. And that's not how any country grows.
Absolutely. We've talked about the fact that, of course, activity can exist in the absence of, structured of progress and structured institutionalized progress, and for that matter. Do you see other parts of the healthcare system across this country in which, of course, activity exists, but there isn't that institutional ownership, that harmony? Do you see it elsewhere outside of public?
Let me flip your question slightly and actually demonstrate one area where I see a lot of progress. For years, our health financing has been in a mess. We've never been sure, are we running a tax-funded system, an insurance-funded system, a fee-for-service-funded system? Because we're doing all of them in various ways, shapes, and form. For many years, you ask people, how many insured Nigerians do we have? No one can give you an answer. But now I see for the first time some serious thinking happening in National Health Insurance Agency in this country. I can see progress happening, digitalization, HMOs being pushed further than ever before. And I'm confident that if the institution is allowed to grow and continue, that we can have a similar transformation in the health insurance and health financing landscape. But none of this can be done overnight. So each of these transformations of specific areas require time, energy, and consistency. And I worry sometimes that our 4-year political cycles is really an impediment for progress in the health sector, because the health sector is not, progress is never rapid. You need time. No matter how good the idea is and the transformation is, you need time. You need policy consistency, leadership consistency. And if there's a change in the political landscape after 4 years and a whole new set of leaders come in, the risk is that no matter how good ideas are, they never just have the time to go.
But Chikwe, is the 4-year political cycle the problem, or the lack of a coordinated handover and buy-in from one administration to?
Yeah, I mean, they're all linked. I don't have any magic insights into what the problems are, but they're all components of this. And very, very often, you see great initiatives that die not because they're not perceived to be valuable, but because, the next leader doesn't want to be associated with something that the previous leader started, unfortunately. So,
I think, of course, we agree that ought not to be a case.
Absolutely.
And should it? So many countries, Nigeria included, use the terms primary care and primary healthcare interchangeably. From a systems point of view, can you tell me what you think is lost when a clinical care system like primary care is more or less subsumed within a public health program? You know what I'm leading up to.
Yeah, I think, it's a complex question and with complex set of circumstances, but
To make it clear,
yes. Yeah, well, I do. So let me give a simple example, going back to our health financing anecdote, so we can continue from that example, right? When you start a health insurance model, but you continue funding your public health care delivery through taxation or through money, then there's no incentive for people to move from one to the other. So for health insurance really to work, money has to follow the patient, right? And so you take money out of tax funded systems into insurance funded models, and that way there's an incentive for people to pay and to derive benefit. And then the system grows. You have to see this as a system that is interconnected at all the levels. So I do think, the radical reform that have happened in other sectors, I go back to what I said in the beginning. We are, the Ministry of Health, if you go to the ministry today, it still has the same departments that it had 40 years ago, right? So we are not courageous. There are many impediments to actually transforming the sector. So the question you're asking, I don't think, why I've gone off a little bit on a tangent is, I don't think the problem is that we don't understand what needs to be done. I just don't think that the political imperatives have allowed us to do what we need to do. And whether it comes to paying doctor salaries and strikes and infrastructure or hospitals, there are really fundamental questions. And I hope we can get to a space where we can answer them.
Yeah. So Chikwe, you obviously have spent a significant part of your career focused on the public sector and public health. You sit now in a very strategic vantage position at the World Health Organization. But of course, we are sitting in a country which is perhaps, reflective of what is happening across much of sub-Saharan Africa as well, in which we are largely dependent on progress being reverse engineered from the private sector into the public sector. But there has to be an optimum balance. What is your vision for how the public sector and the private sector ought to work together?
So I firstly, to think that we are an incredibly blessed country, and blessed in many different ways, right? Firstly, is a little bit of just coincidence that, everyone in my generation, our generation, that was kind of fairly competent in the sciences to a certain level was pushed into medicine.
Yes.
Right? Whether we liked it or not. So we already have a selection of very good people, even if I say that, academically gifted individuals in this field, right? And secondly, a few of us have had opportunities to train, to become specialists, and we also grew up in an incredibly hopeful time in Nigeria, in the 70s and 80s, early 90s, where many of us, were formative years. We're really hopeful. And that had a lasting imprint in many of us, myself as well. So what we haven't done sufficiently is translate this emotional desire and competence to do better for our country into reality, because the systems constrain us. So I think as we begin to unravel and open up these opportunities, there are many. We have many of our colleagues, our peers. Yes, I'm in public health, but we're all part of wider medical communities. I've seen many colleagues come in set of practices, figure out how to swim in this very difficult area, right? And do incredibly inspiring work, set up hospitals, services, not just in Lagos, but across the country. Despite the challenges, we have to remove the despite and actually see this as an opportunity and not a constraint or a competition for the public sector, and see how can the public sector use the private sector or benefit from the private sector and vice versa. And I think that's where magic might happen if we get it right, because, we have probably the biggest pool of skilled health sector professionals, not just doctors, around the world. And we have to be intentional on how to bridge that gap. Again, I don't want to provide all the solutions, but I think that there's an untapped opportunity in that space.
Of course. And of course, one of the essential roles that must be warehoused in the public sector is that it sits as a body, if you like, to commission and to regulate.
Absolutely.
Standards and to commission services.
Absolutely.
Can I tempt you to comment on that and perhaps append to that anything else you feel should be happening in the public sector and that it's intersection with the private sector?
Yeah, you see, I think that for us in this space, there's actually nothing new to be done, because a lot of these things have been solved in many other contexts. We just need to understand, how do we adapt, not bring everything, no copy and paste solution, but adapt them to our context, And when I did a small project in one of the states in southeastern Nigeria, and I went to the State Ministry of Health at the time, and I asked them for a registry of the hospitals in that state. I was given a notebook, handwritten notebook, with names and vague addresses. How do we manage registered sector in state X if we don't even know who is practicing here, what's your bed capacity, what services do you provide? So either the public sector has to have the competence, expertise to be able to manage the sectors. Managing it means first understanding what you have, where the gaps are, what and all of that. So, yeah, I don't want to sound too negative. What I say is, in that gap are the opportunities, incredible opportunities to open up and to serve our country, and not to compete across sectors, but really to benefit from the resources that we all bring.
Certainly. So, Chikwe, with everything that you have seen, both institutionally as well as personally, what kind of leadership do you feel that the world, that Africa, that Nigeria needs in advance of the next global crisis?
Wow. The leadership is such a broad term, but in certain areas, I don't think we can get away from finding the expertise that we need to run whatever we want to run. If we don't think that a teacher can fly an airplane, if we don't think that a doctor can run a telecoms organization, why do we think that we have to consider all sorts of factors in looking for who will run our big teaching hospitals, who maybe have never had any managerial experience? Where will they get it from when they're given an institution like that to run? So I do think we have to be intentional. I know that in our country we have to solve for geographical diversity, we have to solve for religious diversity, we have to solve for all sorts of issues. Granted, within our 200 million people, we should be able to do that. But to get our country to work in specific cases, we need the expertise, the people that understand what they're asked to do, have proven that expertise, and are committed to working and delivering on that issue.
So what next for Chikwe Ihekweazu like this?
Well, Stokes, I'm really in a privileged position at the moment. I'm very lucky to work with a team at the World Health Organization where every day, leading the Emergencies program, I'm constantly at the alert in terms of where the next challenge is coming from. On the infectious disease front, I'm fairly confident that we have progressed a lot. What really hurts me at the moment in terms of our work is the countries where there's a big public health crisis, consequence of a political crisis. So countries that are unstable for whatever reason, where the big health consequences that we have to deal with, because a little bit we're at the bottom of the pyramid and we can't really influence the politics. So I'm lucky to be there. I'm lucky and happy and proud to be working with a leader that I trust and I'm committed to. And we'll see what the future holds.
Absolutely. Absolutely. I won't press you any further.
Thank you.
But I will speak of the future. So finally, Chikwe, after everything you've experienced, the crises, the politics, the pressure, what precisely gives you hope about the world we live in today?
Yeah, Dogs, what gives me hope? Literally, two things. First, my experience at NCDC is we are a gifted country. If I had taken on face value what I had seen in the first month of my time at NCDC, I would have run away. But we are a resilient people. It is the same people that grew, that developed themselves, that developed the expertise, that went way over the call of duty. The first 3 months of the pandemic, nobody was working in Nigeria. Everybody was home. We had 20 teams from NCDC in 20 states in Nigeria supporting them. There was no foreign support. There are no partners. This was the core team. So I have seen our country work. It's an incredible experience seeing it work. So that leaves me with a lot of hope about the future. I think being at the World Health Organization at the moment is also quite an eye-opening experience because of the multilateral nature of the work that we do. And the fact that doing the World Health Assembly, where every country is on the table, and whether you're Seychelles with 200,000 people, or whether you're China with 1.4 billion people, you sit around the same table, you have conversations, you have 2 minutes each to speak, and you have to reach consensus. And I have witnessed the power of that process and why it is so important that as long as we have nation states in the world, we have to go through that consensus building process in a space like public health. So my life is already a blessing, and to have played a small role in these processes, I think I can go to bed and sleep well at night. But my job is not done.
Dr. Chikwe Ihekweazu, thank you for your service. Thank you for joining us on ONE2ONE.
Thank you very much, Dukes.
Thank you, Chikwe.
Thank you.
Pleasure. Thank you.